Can you manage type 2 diabetes without daily medication? Why does blood sugar go up even when you're not eating sweets? And is it true that some common medications, like those for blood pressure or cholesterol, can lead to a false diagnosis of diabetes? We'll answer all of that in this video. Many people believe that type 2 diabetes is permanent, but in reality, it can often be brought under control, sometimes so well that your blood sugar stays stable without needing constant medication. This video breaks down 7 simple but powerful steps that can help you manage type 2 diabetes naturally. And toward the end, we'll also talk about a few exceptions, when these strategies might not be suitable. Step 1. Make sure you actually have type 2 diabetes. For some people, high blood sugar isn't caused by diabetes at all. It can be a side effect of medication. This is especially common with birth control pills, hormone therapy, certain antidepressants, blood pressure meds like beta blockers and diuretics, and cholesterol-lowering drugs like statins. These medications can raise blood sugar levels, and in some cases that leads to a mistaken diagnosis of diabetes, even though the real problem is drug-related. So take a look at the leaflets for any medications you take daily, and if you're unsure, talk to your doctor about it. Step 2. Replenish B vitamins. Many people who take metformin, such as glucophage or Siophor, experience reduced absorption of vitamin B12. This can lead to irritability, insomnia, and even mild depression, especially in older adults. B vitamins also support the nervous system and help improve insulin sensitivity, which is key in type 2 diabetes. That's why it's recommended to take B vitamin supplements once or twice a year, either by mouth or as injections. Ideally, do this under medical supervision. Step 3. Get enough sleep. Not sleeping enough can raise blood sugar and increase insulin resistance. That's when your body doesn't respond well to insulin. If you sleep less than 6 hours a night or stay up past 1 a.m. regularly, your risk of worsening diabetes goes up. Studies also show that people who don't sleep enough tend to crave more sugar and fatty foods. Recommendation: get at least 7 or 8 hours of sleep each night and go to bed before midnight. How's your sleep? Let us know in the comments. Have you noticed a connection between poor sleep and higher blood sugar? Step 4. Rethink your diet. Besides cutting sugar and refined carbs, it's also crucial to avoid soda and sweet drinks, fast food, sweetened tea and coffee, and alcohol. Healthy alternatives. Blueberry leaf tea that helps lower blood sugar and supports blood vessels. Chicory instead of coffee supports the pancreas and helps reduce both blood sugar and cholesterol. Also increase your protein intake. Meat, poultry, fish, eggs, boiled or stewed. Buckwheat, leafy greens, beans, peas, and bran all help stabilize blood sugar and cholesterol levels. By the way, would you like to see a full video just on food and nutrition for type 2 diabetes? Type, "I want the food video" in the comments and we'll prepare it. Step 5. Use herbal remedies and cycles. Herbs with proven benefits for type 2 diabetes include chicory, blueberry leaf, dandelion root, bean pods, and lady's mantle. You can choose one herb, brew it as tea or make a decoction, and drink it for 1 month. Then take a 2 to 3 month break before trying another herb if needed. Important: stevia still lacks solid clinical evidence. It's better to rely on the herbs we've listed. Chicory can be used daily, either in place of coffee or alternating with it. However, before trying any herbs, consult your doctor, especially if you're already on medication. Step 6. Follow a structured eating schedule. With type 2 diabetes, eating frequently in small portions isn't always helpful. It's often better to stick to 3 full meals a day, with no snacking in between. Why? People with type 2 diabetes already have elevated insulin levels, and frequent eating can trigger even more insulin release. If you leave enough time between meals, your insulin levels have time to drop, and your body becomes more responsive. Exception: if you've recently had a heart attack or stroke. In those cases, this method might not be appropriate. Always talk to your doctor first. Step 7. Get more physical activity. Any movement helps lower blood sugar. Walking, swimming, skiing, climbing stairs, or doing light workouts. Exercises that support the pancreas are especially helpful. Movement is one of the most effective ways to manage your sugar levels. Have you noticed how physical activity affects your blood sugar? Share your experience in the comments. Your story might help others. These steps can help you stabilize type 2 diabetes without depending on medications, just by adjusting your lifestyle, diet, and habits. But always check with your doctor before changing your treatment plan. Thanks for watching. Subscribe to the channel so you don't miss upcoming videos on diabetes. Like the video if it was helpful, and be sure to check the comments. Someone else's tip or story might be exactly what you need. Take care and stay healthy.